Welcome back to a new mini series. We'll just call it a mini series because that's easier. So, obviously, we are been in a very interesting time for the last few months. There has been this thing called COVID-19. I don't know if anyone's heard about it, but it's been there. And this virus has basically changed the way we are currently living our lives, and it seems like it's going to be that way at least for the foreseeable future. So, there's obviously a lot of coverage on COVID 19. There's a lot of debate about a whole host of things, ranging from when should a country reopen, how much testing should be done, how many deaths are too many deaths. A lot of different things out there. And naturally, because of that, there's a ton of data out there trying to help answer some of those questions. And so, probably the next two videos, I'd say maybe three. I'm not planning to spend a tremendous amount of time on it. We're going to talk about COVID 19. There's not going to be any programming with this one, just simply exploring some data sets. I'm going to be showing you where those data sets are, at least some of the ones I found. And then I'm going to be showing you a little bit about how to pull these data sets into Excel using Power Query, because that's the nice thing about Excel is you can pull in all this data using Power Query and put it into your own little tables. And then you can create a pivot table or a pivot chart off of those wonderful objects and then do your own type of analysis. Now, the goal is I'm not here to push you in a certain direction. I'm here to simply say, here's some data. Let's take a look at it and let's try to look at it from both sides. And let's try to understand, maybe why we might be hearing certain numbers more than other ones and what those numbers really mean and some of the challenges with it. Now, by no means am I an expert on this topic, but it has been interesting, at least for me, to kind of explore this and understand how it's kind of progressed over the last few months, because I think, you know, you hear a lot about it. I don't think necessarily you see all the data behind it and some of the challenges that I think a lot of public officials are having to make when it comes to, thinking about what should they do to help limit the spread. How do we do things like making sure we don't overwhelm the healthcare system, but we don't also impede too much on people's freedoms at the same time? These are all balancing acts, and it's not necessarily a clear-cut path of how to do it. There's not a manual out there that says, well, do this, and then do that, and do that. A lot of it, you have to make those decisions real time based on the data that you're seeing. And so that puts a lot of people in these very challenging situations where they have to make decisions, and they're not always the most popular ones. And in some cases, they're highly debated. But at the same time, there's usually a reason they were made. And usually what I find is if I look at the data, I can usually see both sides and I can understand a little bit more about like why one person is saying something compared to other ones. So I do have this workbook on my Facebook group if you'd be interested in it. You go to Sigma Coding on Facebook. So Facebook.com/coding Sigma. And then you go into, where do you go? The groups. And you go to the Sigma Coding group. It's the second one. It's the COVID-19 analysis. I will probably have this on my GitHub as well, and I will probably have another workbook on there. That one will be massive. So that's actually, I think, every death. Is it every death? No, it's every case. I think it's every case inside the United States or something like that. It was like 1 million rows of cases of COVID-19 cases. So if you want to go to literally each individual case and do some type of analysis, you will have that data set as well, if I can remember where I got it last time. But that was an interesting one because they'll talk about things about, male versus female, age groups, underlying conditions, and all sorts of fun stuff like that. But again, I think really at the end of the day is helping you get a better understanding about, what is COVID-19 and, why are you seeing certain numbers compared to other numbers, right? Additionally, I personally, like, whenever I do analysis, like, I always have these questions going on in my heads. And I think with this particular topic, I kind of put them into two categories. There's these kind of tough questions, and then there's these tougher questions. And the tough questions usually have, a more clear-cut answer, where the tougher questions can obviously be a little bit harder to say, well, what's right versus wrong, right? So some of the tough questions might be something very simple, like what defines a COVID-19 death? Is that consistent across countries? If I'm counting it in the United States versus Europe, is that going to be something where I might see discrepancies? Like, so does maybe France count it differently than the United States? Does Germany count it different than the United States? Does Taiwan or Japan count it differently than the United States? Or are we all pretty much on the same? These might not seem like important topics, but ideally these are crucial when it comes to getting a baseline. So I can make sure that I'm talking to apples, right? I want those nice, easy comparisons, but it also tells me where I might have to make adjustments to my data to make sure that I'm seeing things in the same way. Additionally, some other ones too, like what defines a COVID-19 recovery. This also you'll see discrepancies, right? This is probably where you'll see a ton of discrepancies because there's really not a definition out there right now. There's not a clear-cut definition as to what defines a COVID-19 recovery. Do you have to have a positive test or do you just have to be asymptomatic for 3 weeks after getting a positive test? I don't know. It depends. You have to, this is stuff where I think I have some CDC sources. I'll try to put them, I think, in the workbook. But then this naturally goes into why recovery counts so low. So this was a really interesting one. I think I have this one. Daily. Here we go. Where's my fields? There's my fields. So, recovered. Here we go. I do have it in here. So let me take out some of these ones just to kind of give me a nice little baseline. So you have recovered, and then you have, where is it? Total, and then you have positives. But that's positives over day. We want positives. Where is it? Hospitalized. I can't remember. We'll deal with that one later. I thought I had it already. But yeah, so the problem is that recovery counts seem to be kind of lower compared to what your infection rate. So I think when I was looking at it, was something like in April we had, or was it May? I think we had like 1.1 million cases, and yet we only have like 500,000 recoveries, and it's kind of weird because naturally what people say is most people usually overcome most of the situation, most of COVID-19 within a few weeks, right? So it's like 3 weeks, but then you can have like anomalies where people will literally have symptoms for months. I mean, there's definitely a group out there where they'll have symptoms for months, and well, not necessarily, I guess, months, but like a very long time. It's not the standard time. And so that can make it a little bit challenging. Just different things too. Like these are kind of, again, kind of tougher questions, which is, when should a country reopen? How do you determine if a country is doing enough? And then you get these really tougher questions. So these are the tough ones. How many COVID-19 deaths is too many? Those are questions that have to be asked, unfortunately, because at some point things are going to have to reopen. And at that point, you have to ask the question. I know if I reopen, I'm going to have more deaths. How many deaths are we comfortable with? I mean, as much as you'd like to think that there's going to be no deaths, there's going to be some deaths. So the question is, how many is too many? The same goes for the economic damage. Why are we so concerned about economic damage at this point? Well, we've seen in the past that a country who can go through a substantial amount of economic pain leaves themselves open to a lot of other pain down the road. It can be political upheaval. It can be just kind of societal disruptions that can take many years to recover. And that's also a valid question. How much economic damage is too much economic damage? In some of the more Western countries, how many restrictions is too many restrictions, and for how long? A lot of these countries, they have a lot of different rights that are supposed to be defended by these countries. And so naturally people are going to say, well, how long should I be forced to stay in my home? 3 months, 6 months, 9 months? And so these are tough questions because there's not really a clear-cut answer. And you'll often find they go one right within the other. And it's a balancing act, and it's a constant reevaluation as to, how many is too many. So those are some challenging questions. And I would encourage you, ask these questions yourself as you're going through it. Data sources, yay! So I do have a couple data sources. There's a ton out there, but these are just a few that I personally use. And so I will go over some of these and just give you, high level what I thought about and why I personally was using it. The first one is the COVID tracking API, so the COVID tracking project. And so This is a really cool API. I don't know if most of you have seen it, but the COVID tracking project. So this is basically primarily for the United States. And so this is a nice way where if you want to get individual state data for the United States, you can get that. And you can even get it down further, down to hospitalizations, ICUs, ventilators, outcomes, test results. So very useful when you're trying to get trends over time. Additionally, these guys are awesome because what they'll do is they provide data sources. So they say, this is where we got the data from. And so this is even more helpful because now you can see where you're getting that data from. And this makes your analysis even that much more better, where if you want to go in there and you want to look at certain things, you can go back to it. So I really like this site because A, it's very granular and they give you data over time. So they give you historical and current data, but at the same time, they'll redirect you back to the source if you need it. And so this is very helpful. This makes our lives easier. And so I encourage you to take a look at them. They also have, if you want, I think it's the data API. So if you want to use an API to get it, they have it down to US current and historical data. You have state current and historical data, and then that's pretty much it. So again, this is pretty much all US data. And then if you just click any of these things, you'll see the different formats that you can get it. So you can get it in a CSV file, or you can get it in a JSON file, and then they'll let you know each of the fields, and they'll let you know which ones have been depreciated and which ones are currently active. So some of these are depreciated. Some are not depreciated, but the information is there in case you need it. And again, very helpful when you're trying to do different types of analysis. Additionally, you do also have to recognize at some point, the data is not going to necessarily be as abundant as it might have been 2 months ago. So a lot of times the governments have to decide how much time and resources am I going to spend in collecting this data. And so you will see, as things tend to get better, you will sometimes see a decrease in the amount of data. So I'm already seeing that on some of these sites where certain data that was very abundant across almost every country is all of a sudden starting not to be so abundant. And also, the next one we're going to talk about is Our World in Data. So this is not just COVID-19. This is actually a site that provides a lot of different ones. But for this one, they have their own GitHub page, and they have a GitHub page that is dedicated just to COVID-19. So they have it by ECDC, testing, and the World Health Organization. They have JSON, CSV, and Excel, and then they have a cookbook as well. So very useful. Again, they provide a lot of information about how the data was collected, how it was altered to standardize it. A lot of good things where if you're just trying to get a better understanding as to why certain things are happening, it's all right here where you can look at it nice and easily. So I love this. And then they also have a nice web page. I love this web page so much. Oh, I love it. So again, they don't just cover COVID-19. They have health, they have demographic changes, knowledge and education. But obviously, since this is COVID-19, we're going to talk about COVID-19. This page is awesome because you can compare by countries. They give you these nice interactive charts where you can kind of see and compare across different countries, different continents. So very useful. And then you can see things over time. Super helpful, super helpful. And then if you want to go down by more specific topics, so we're kind of right now on the Data Explorer tab, you can go on more specific topics. So deaths, if you want to look at COVID-19 deaths, you can see those, and you can look at different metrics, and those metrics either compare to other countries or over time. Now, very important to keep in mind, you got to make sure you understand how these charts are built. So some are linear, some are log based. Often that's the challenge, right? You know, we have a lot of countries, different sizes, and we're trying to get a good comparison. So you're going to see that sometimes. It doesn't mean it's a bad thing. It just means that sometimes you have to compare it a little bit differently. Additionally, you also get this wonderful flexibility where you can adjust the timeline. And then here's the cool thing. You can move the timeline. It's pretty neat. I think this is awesome where it makes it so nice like that. And then you can look at the daily number of confirmed deaths. So we were in a nice downtrend and then we kind of flattened out. And then it seemed like recently we had a spike. We'll have to see where that spike goes. So it's kind of hard to say at this point, but you can also add countries as well if you want. So if you want to put the United States in there, so that's where I'm at. You can put in, who else? We can put in South Korea, put in Mexico, Finland, France. How are we all doing? So this is also one of the other challenges. This can always be a little bit hard because you have different population sizes. And so if you use absolute numbers, you're going to see certain countries are just going to always dominate. So for example, if I was to look at something like India, where they have over 1 billion people, there's potential where I could see much higher numbers on every metric because you have 1 billion people. So that's why a lot of times you'll see these logs and stuff like that to kind of help level the playing field and give you a better idea as to what is going on. So that way you can see whether it's improving or not improving. So yeah, I really like this website as well. It's just nice where they break it down by each topic, but then they also have like very specific things too. So they'll also have like policy responses. So you can look at school closures, workplace closures by country, public cancellation of public events, restrictions on public gatherings, public information campaigns. This is really valuable data. And I think at the same time, it helps paint a picture. It helps getting a better understanding maybe as to why some countries are doing better than other ones, but then also painting the problem of reality, which is as much as I would like to have certain things happen, I might be restricted by certain realities. As much as I would love to have completely wide rampant testing, if I'm a small country and I don't have a very large manufacturing base, and a lot of countries aren't necessarily sending tests everywhere, that can present a challenge. I might not have the capability to do the testing. But on the flip side, you have a large country like the United States, India, China. It might be a lot more challenging to do extremely rampant testing because you have a large geographic base that you have to cover, and you have a much larger population to cover. So those are some challenges when it comes to looking at some of this stuff. You can look at how countries have to, well, I think testing policy is honestly a good one because you can see some have very open testing. I didn't realize this, but apparently in Europe, it's not as widespread as I thought it was. I thought anybody pretty much could get a test. It looked like France, United Kingdom, Spain, they're actually a little bit more restrictive. So you have to have symptoms in order to get a test, where you'll see a lot of countries like Canada, Greenland, who was that? Germany, China, Taiwan, South Korea. Those ones have open public testing, so anybody can get a test, even if you're asymptomatic. But that can also explain why you might see higher test rates compared to other ones, because again, we know that asymptomatic does make up a large population of those who are infected. And so that's why you might be seeing higher numbers in some countries. Contract tracing. Again, that is a challenge in some cases because again, in some cases, if the ease of travel is very possible in countries, it's very hard sometimes to say, well, where do they interact? Or they went into a store with 1,000 people. It might not be possible. Income support and debt relief, government stringency index, mobility, a lot of good data here as well. So that's our world in data. And then we have the CDC. Woo, the CDC. So the CDC has a lot of good data as well. And so most of the time you have to go to their data catalog. And on that data catalog, you can look for certain topics. So if I type in COVID-19, for example, I'm going to see topics related to COVID-19. And you can see here, some are provisional death counts, some are death counts by sex, age, and state, excess deaths. So they are providing a phenomenal amount of data. And when you usually go onto any given topic, what you can then do is you can explore the data. You can also get an understanding of how the data is structured. So data types, what that field represents, the number of rows and columns, and then you can view the data, and then you can actually make charts as well too. So you can do a lot of good stuff here where if you're just trying to explore it, it does make it a little bit easier. So I personally love this. I think it makes working with the data 10 times easier. And personally, I haven't used the CDC very heavily before this, but I will say I'm very much impressed by what the CDC is offering. So I was all on board. If you do want to export the data and you might not have a programming background, that's fine. You can do export and then you can do a CSV. Or if you would like, there is also an API as well. So you can actually change your data type. So if you want JSON versus CSV, you can, and then you can copy it. And then if you paste this wonderful thing in here, you'll see it's just a JSON data structure. So very helpful. I do love the CDC in that regard because there's a lot of good data here. Most of the time, it's going to be solely on the United States because, again, CDC, United States, but very useful if you're just trying to get a good understanding as to, how is data going. If you want things by race, that's also a very hot topic right now. So being able to get that as well. But yeah, I would definitely say if you can, take a look at it. I think you'd be surprised just kind of what's there. I was very much surprised about it. I think it's one of these two. One of these is going to say like 1 million rows, and that's the one that I think is like every death. It's something insane. I want to see if I can if I can't find it right away, I'll just grab the link in the next one. But yeah, one of these data sets, it's literally every single death, which I was just it was like 1 million rows or something like that. So I was very surprised that they were able to track all of that. Or maybe it was, no, I think it was every case, not every death. But they were talking about like every case they had identified, and I was just like, wow, I can't believe they were able to track all of that. That's impressive, but I can't find it. I'll just deal with it later. But yeah, so the CDC is another one that I have in here. And then I also have the COVID tracker API. So this one is actually some of the data sources that are specifically used in the COVID tracker API. So this was the government stringency data set. So I kind of like this one as well. I don't know if I'm going to be able to get here right away. Let me do this because I know I have it somewhere. Yes, because it was this one. Here we go. Sources, government response tracker, because this is where I got it from. And then they will redirect you. So the University of Oxford provides a tremendous amount of data as well. So I would encourage you to take a look here, but you can actually, they'll also give you some information here if you need it. And then you can look at the API, and then you can also, they'll tell you how to use it as well. So very useful, again, if you're just trying to collect data. I mean, this could be for work, for school, whatever it is, if you're just trying to do like a project on it. A lot of good data if you're just trying to do some stuff. And then how I have it labeled is the color you see here. If you go on each tab, that's the data set. So that was just one. I didn't pull all of them, obviously, because there's like 100 different data sets. But I just try to pull some that at least I thought were interesting. But you want to look by the color to determine, what is what. So you can see orange is orange, red and green. And then I have our hot pink. And then we have some blue. These are the actual pivot charts. So if you want to look at those as well, they are there for you to see as well. But yeah. Oh, that was a thank you. But yeah, so I think that's good for this one because I think, 24 minutes is more than enough. So I think in the next video, what we'll do is I'll kind of show you how to use Power Query to just pull in some of this data. It's not going to show you how to do every single one, but I think hopefully that should be enough to kind of get you comfortable with the process of using Power Query to pull this data in. And then we'll spend a little bit of time just, looking at some stuff. Again, not necessarily going to point you in a certain direction, just more of, let's talk about some things that we might be hearing on the news and, try to get an understanding about maybe why we're seeing that. So if you have any questions, by all means, put them down in the comments below. If you have any suggestions, I'm always open to hearing that as well. If you want to contribute to this is going to be on GitHub. So if you want to, um, put in some other data sources that you think might be useful, by all means, I'm always open to seeing that. Because I'll probably just get all excited and start exploring it. But I think there's a lot of data out there, and it's obviously a lot for one person to kind of gather. But if you have some insights on it, or maybe your own perspective, as long as you can keep it respectful, by all means, share it. So thank you again for watching, everybody. We'll see you in video number 2.